Hi, today is Thursday, November 25th, 2021, and today is my payday. I'm waged employee, I'm a salaried man. I work for KT, Korea Telecom, and I'm a manager for foreign customers living in Korea. Also, I uh, take care of foreign corporate customers like DQ, Cisco Korea, GSTK, or Grupo Promax from Mexico, and other big foreign corporate customers or factories whose parent companies are overseas. Uh, that's not the point of discussion for today. For my daily English reading, I will just check if our headache is connected with something that is going on inside our stomach. I occasionally had headache, but someone gave me a roasted salt, some it's ordinary salt, but it's a 15 years old and a little bit special salt. And she roasted it and she gave one small bottle, like two Mountain Dews size. She gave the that amount of salt to me, and I started to drink my coffee with that like a big spoon full of salt, and mysteriously my I don't know my stool my shit turned from liquid to solid, which is normal, back to normal after 3 years of taking herbal medicine. And then mysteriously, my headache, occasional migraine or tensional headache, almost gone. I feel lighted. I don't know, maybe it's because of Pfizer shots that I got for my COVID. But somehow my brain is light. My head is very not heavy anymore. So I think something has to do with stomach as gastronitis. So aren't you interested in what a stomach can do for our brain? Yes. So let's check out what the brain stomach connection is, what is going on, and what is all about. So here we go. This is my English daily reading. I have nothing to do with the content. I just read to practice my English. While I read the material, I will try to pick up some interesting expressions and words. Many of them I already know, but I would like to remind of those expressions to me and try to memorize them. Because English is my second language, I'm Korean. I constantly need to practice English. I don't have a girlfriend. I'm married, but sometimes I wish to have some, uh, English speaking native girlfriend. Not necessarily for sex, but to just to go out together. Especially go out for anti-cancer type walk and drive through the countryside, uh, pick some berries, persimmons, or other wild fruits, and enjoy a meal and check out the sceneries, tour the country, discuss this and that. especially consciousness development. I'm an Avatar graduate, so I'm very interested in our belief systems and what the belief can do to our body or our general welfare and maybe our life path in general. So that's why I practice English. So, yeah, let's cut to the chase and get down to the business. Child Mind Institute. That's a good name, and that's a good icon. 3 layers of people, a person, a dark person. Inside the dark person, there's a white person. Inside the white person, there's a blue person, maybe inner child. Anxious Stomach Aches and Headaches by Carolyn Miller. Family Resource Center, Anxiety. So this is possibly the medical center or psychological counseling service center. Anxious stomach aches and headaches. Physical symptoms are often the way children experience anxiety. Carolyn Miller and Espanol. What you will learn, what are some common physical symptoms of anxiety in kids? For everyone who is listening to me, I am kind of inebriated a little bit. I drank like more than one can of beer of sake. We have special Korean sake called Hansan Sogokju. It's very sweet, delicious, but also it is toxic. It's alcoholic. So I drank a little bit of that. It's stronger than beer. So I'm still feeling the effect of the alcohol in my system. So bear with me while I try to read this material. What are some common physical symptoms of anxiety in kids? How can kids with anxiety learn how to manage their symptoms? What can parents to do help kids overcome their anxiety? Quick read. All kids get headaches or stomach aches sometimes, but when it happens often, they might have anxiety. For example, kids with anxiety might get stomach pain or a headache before going to school or a birthday party. Kids who feel this way may not know they are anxious. That's me. That was me when I was a kid. Kids with anxiety aren't inventing these symptoms or trying to get out of things. A headache or stomach pain can happen when the child's body reacts to something the child feels is dangerous or scary. The first step to helping your child is to check with your doctor to make sure there's no medical reason for their pain. That's very logical, but I don't follow this path. Not necessarily I'm ignorant, but possibly I don't trust Western medicine doctors. If there's no medical cause, let your child know their body is reacting to what they are feeling. You might say your stomach hurts because your brain is saying something dangerous is happening. It's your emergency system responding to a false alarm. This lets them know that what they are feeling is normal and gives them a sense of control. Eventually, they'll be able to say, my stomach hurts, and I remember that's because I'm feeling worried. Helping them practice getting through the anxiety is more helpful than letting them avoid the things they feel anxious about. If your child's anxiety makes daily life hard, they might have an anxiety disorder. In that case, a therapist can help, or the avatar course. The therapist will likely use cognitive behavioral therapy (CBT) to help your child identify their anxiety and learn skills to reduce it. Yep, I think a meditation or the conscious development course, such as the Avatar course by Harry Palmer, can help. Full article, 6-minute read. All kids get an occasional headache or stomach ache. Think not enough sleep or too much Halloween candy. But when children get them often, they may be signs of anxiety. Stomach aches in the morning before school. Headaches when there's a math test on the schedule. Butterflies before a birthday party. Throwing up before a soccer game. These physical symptoms may be the first evidence a parent has that a child is anxious. In fact, the child may not even know they are anxious. That's terrible, especially with the kids who may not be able to verbalize what they are feeling anxious about. The way their anxiety manifests can be through physical symptoms, explains Amanda Greenspan, LCSW, a clinical social worker at the Child Mind Institute. Physical symptoms of anxiety. In fact, anxiety is associated with a host of physical symptoms, including headaches, nausea, vomiting, and diarrhea, along with a racing heart, shakiness, or sweating, symptoms older people experience when they are having a panic attack. All these physical symptoms are related to the fight or flight response. Fight or flight response triggered when the brain detects danger. When the brain detects danger. Fight or flight response. Fight or flight response. Fight or flee. Fight or flight response. All of them have a purpose, notes Janine Dominics, PhD, a clinical psychologist at the Child Mind Institute. When she talks to kids about anxious headaches or stomach aches, she explains the role of each. For instance, she says, your stomach hurts because your digestive system is shutting down to send blood to other areas of your body. You don't want to be digesting food at that moment because you are trying to either flee danger or fight danger. Flee danger or fight danger. Dr. Dominics assures children that these symptoms are not harmful. They are just their emergency system responding to a false alarm. But it's important to understand that kids aren't necessarily inventing their symptoms, and the danger may feel very real to them. Don't assume a child who spends a lot of time in the nurse's office at school is doing it intentionally to get out of class. Their acute anxiety may be causing them pain. Headaches and stomach aches related to anxiety are still real feelings, real thing. And we want to take them seriously, says Mrs. Greenspan. Check with your pediatrician when a child develops a pattern of physical symptoms before school or other potentially stressful moments. Experts recommend that you visit your doctor to rule out medical concerns. But if the child gets a clean bill of health, the next step is to help the child make the connection between their worries and their physical symptoms. We help them understand in a very child-friendly way that sometimes our body can actually give us clues into what we are feeling, explains Mrs. Greenspan. Parents can start by validating their child's experience and validating or acknowledging their child's experience and reframing it in a more helpful way. Instead of telling kids there's nothing wrong with them, the goal is to tell them that what they are feeling is worry. You are validating their child's experience and reframing it in a more helpful way. We give it a name as Dr. Dominique's. We help them connect it to an emotion and label it. And after some practice, kids are able to identify it. She adds, yes, my stomach hurts, and oh yeah, I remember that's because I'm feeling worried. And after learning some skills to help them calm down, I think they feel a sense of control. And that helps. What can parents do to help? The first thing our experts suggest is something parents should not do, or at least try not to do. Let kids avoid things they are afraid of. It can be very tempting when children are complaining of a headache or stomach ache to let them stay home from school, or skip the pet party or the game they are worried about. But avoidance actually reinforces the anxiety. If you are allowing them to avoid this, says Mrs. Greenspan, then they are not able to learn that they can tolerate it. The message needs to be, I know it hurts, I know it's uncomfortable, but I know you can do it. Another thing parents should not do is ask children leading questions like, are you worried about the math test? Questions should be open-ended to avoid suggesting that you expect them to be anxious. How are you feeling about the math test? How are you feeling about the math test? That's a good question. Reframing it. Another thing parents should not do is ask children leading questions like, are you worried about the math test? Questions should be open-ended. That's good advice. That's solid. On the spot. Hit the nail on the head. Questions should be open-ended, not close-ended, open-ended, to avoid suggesting that you expect them to be anxious. How are you feeling about the math test? If the problems your child is having are disrupting their ability to go to school consistently or concentrate at school, participate in activities, socialize with peers, they might have developed an anxiety disorder that should be treated by a mental health professional. The treatment favored by most clinicians for anxiety disorders is cognitive behavioral therapy, CBT. CBT helps kids as young as 5 years old identify their anxiety and learn skills to reduce it, CBT. cognitive behavioral therapy. Cognitive behavioral therapy, CBT. The techniques clinicians teach children to calm down body and mind can also be deployed by parents for children with less impairing symptoms. Always questions should be open-ended. How are you feeling about the test? Techniques for calming down. Here are some of the techniques clinicians teach anxious children adapted from CBT and mindfulness training: deep breathing, mindfulness exercises, coping statements, coping ahead, acceptance. Deep breathing, drawing in air by expanding the belly, sometimes called belly breathing, helps kids relax by slowing breathing and reducing the heart rate, blood pressure, and stress hormones. It can also help relax tense stomach muscles. Mindfulness exercises, techniques such as focusing on what's around them, what they see and hear, can help pull children away from the anxiety and ground them in the moment. Coping statements. Children are taught to talk back to their worries. Ms. Greenspan explains. They can say, "I'm feeling scared and I can handle it," or something along the lines of, "I'm bigger than my anxiety." Something along the lines of, "I'm bigger than my anxiety. I'm bigger than my anxiety. I'm bigger than my anxiety. I'm bigger than my anxiety." Coping ahead. Children are taught that when you have to do something that makes you nervous, it helps to anticipate that you might have some discomfort and plan what they can do to counteract it, knowing that if you can push through it, it will get easier. Acceptance. This involves validation. This involves acknowledging the discomfort without fighting it. Instead of trying to push the feeling away and get rid of it, Dr. Dominics explains, we ask you to hold on to it and tolerate it and get through it. Yeah, avoidance always makes matters worse. The problem becomes bigger, stronger every day. We need to trailblaze through the problem, hard facing it, getting over it, and coming out as a winner. The parent's role is key. Exactly. It's only natural that parents don't want to see their kids in distress or make them go to school when they are worried that they will throw up. That puts parents in a difficult spot. What we hear from parents is we just let them stay home one day, and one day led to 3 months, says Dr. Dominics. It's a slippery slope. The child may ask to stay home more and more. It's a slippery slope. It's a slippery slope. It's a slippery slope. Okay? Fight or flight. It's a slippery slope. Stay home. So we work with the parents a lot around how to find that balance between enabling anxiety and meeting the child where they are, she adds. And we also give them statements that they can use to be empathetic and encouraging at the same time. For instance, I know that this is really hard and you feel like you are sick. But we also know that this is anxiety, and you can get through it. Sometimes setting up a reward system can help by giving a lot of positive reinforcement for kids pushing through their anxiety. Parents also face the challenge of tolerating their own anxiety about pushing a child who says they are ill or worried about vomiting. If your kid is in distress and talking about not wanting to go to school or feeling sick or thinking they might throw up, says Dr. Dominic, then you are, as a parent, also anxious that might happen. Working with a school. The school plays an important role when kids develop physical symptoms of anxiety. Clinicians work with the school nurse and sometimes the psychologist or a school counselor to set up a protocol for keeping the child's absences from class as short as possible. For instance, the recommended amount of time to wait before encouraging the child to go back to class might be as short as 5 minutes. As much as we can, we urge them not to contact the parent or send the child home if they are saying that they are nauseous, adds Dr. Dominics. If we know that they are feeling this way because they are anxious, the shorter the break can be, the better it is, because the longer they are out of the thing that's making them feel anxious, she says, the harder it will be to get them back in. These sort of symptoms can appear in a wide range of children, but they are most common in the grade school years, notes Mrs. Greenspan. As kids get older and transition into adolescence and adulthood, they are more likely to manifest their anxiety symptoms in other ways. Carolyn Miller is the editorial director of the Child Mind Institute. She is a veteran magazine, newspaper, and website editor who was editor-in-chief for New York Magazine, which draws 2 million unique visitors a month. She teaches magazine writing at the Arthur J. Carter Journalism Institute, a graduate program at New York University. Miller's magazine experience also includes stints as editor-in-chief of 17 and Lears. Earlier, she was executive editor of Variety and culture and features editor at Newsday. Her first daily newspaper experience was the Ithaca Journal, where she was a reporter, city editor, and then editorial page editor. With her husband, Eric Himmel, Miller edited September 11, 2001, a best-selling book of photographs that chronicled the terrorist attack on the World Trade Center and the following weeks in the lives of New Yorkers. The book sold out its print run of 60,000 copies and raised $250,000 for the September 11 fund. Miller graduated with distinction from Stanford University in 1970. She received a master's degree in education from Reed College. She resides in Manhattan with her husband Eric Himmel, the editor-in-chief of Harry and Abrahams, the art book publishing house. The couple has 3 children. So she must be old because she got her master's degree in 1970, right? I was born in 1960, so she must be like 22 years older than me, which will make her like 76 years old. That's quite old. Well, maybe young. That's it. So I learned the flight or fight or flight response. Fight or flight response. Run, navigation. That's it. I feel drunk, but I can only think of several expressions like yesterday, fight or flight response, anxious, get through it, or just in general nothing. That's it for my daily English reading. Thanks for listening. Take care. Bye bye.